Welcome to the What Does Science Say channel.
So, let's jump right into a feeling I think we all know. That moment of panic when you can't find your keys, or when a name is right on the tip of your tongue but just won't come out.
We've all been there, right? And it's totally natural to wonder, hey, is this just a normal part of getting older, or could it be something more? Well, you're not alone in asking. And to give you a sense of the scale we're talking about, back in 2021, a staggering 6.2 million Americans were living with Alzheimer's disease. Now, to really get a handle on this, the first thing we gotta do is clear up some major confusion. You hear the words dementia and Alzheimer's thrown around, sometimes like they're the same thing, but they're not. Think of dementia as an umbrella term. It's not a specific disease. It's the name for a set of symptoms, like memory loss or confused thinking, that are bad enough to get in the way of daily life. It tells you what's happening, but not why.
Alzheimer's, on the other hand, is the disease. It's the specific illness that's causing those dementia symptoms. And it's the big one, the most common culprit by far. So that brings up a really important question, right? How do you know what to look for?
The real trick is telling the difference between just, typical age-related hiccups and something that might be a red flag. Let's break it down and compare. Okay, so let's say you forget a name, but then it pops into your head later. That's pretty typical. Happens to the best of us. But if we're talking about memory loss that really gets in the way of your day, like forgetting things you just learned or asking the same question over and over, that's a different story.
Or how about this one? Making a little math error when you're balancing your checkbook? That's one thing. But suddenly finding it hard to follow a recipe you've known by heart for years, or really struggling to keep track of monthly bills, that can be a sign that something is up with those problem-solving skills.
This quote really hits home. A geriatrician shared a story about a patient who would tell this charming story about looking forward to beans and greens for dinner. The thing is, he'd tell it again and again, just moments apart. It was so charming that people almost missed it, but that repetition was the real clue that something deeper was going on.
And it's not just about memory either. You've got other big signs to watch for, like getting lost in a place you know like the back of your hand, pulling away from friends and hobbies, or sudden shifts in mood. It all points to the fact that something is physically changing inside the brain. So, what exactly is going on in there? Okay, let's get into the nitty-gritty. Deep down, Alzheimer's is basically caused by two main villains that are wrecking the communication network in the brain and eventually killing off brain cells. First up, we have these things called beta amyloid plaques. You can think of them as these sticky little bits of protein that start clumping together outside the brain cells. It's kind of like getting a bunch of gunk stuck in the gears of a machine. It just gums up the works and stops the signals from getting through. Then for villain number 2, we go inside the brain cells. There's a protein called tau. Its job is to keep the cell's internal transport system, think of it like a railway, stable and strong. But in Alzheimer's, tau twists itself into knots, forming what we call tangles. When that happens, the whole railway system just falls apart, and the cell basically starves to death from the inside. So, you've got these plaques gumming things up on the outside and tangles destroying things on the inside. The result? It's devastating. Brain cells die off on a massive scale, and the brain actually starts to shrink. This physical damage is what causes all those symptoms we see. Which leads us to the big question: what on earth can we do about it?
Now, while there isn't a cure just yet, and that's important to say, there is a ton of hope, especially when we talk about reducing our risk.
And just how much of a difference can we make? Well, get ready for this number: 40%. That's not a typo. Research from the Lancet Commission suggests that we could potentially prevent or delay almost 40% of dementia cases around the world just by focusing on key risk factors. I mean, that's huge.
So, what are we talking about here? It's stuff that's actually within our control. Things like keeping your blood pressure in check, staying active, even protecting your hearing, getting good sleep, eating a healthy diet, it all adds up. But that's prevention. What about care for people who are already on this journey?
On the medical side of things, some medications can help manage symptoms for a while, but they don't stop the disease in its tracks. And that's why the human element, the care part, is just so incredibly important. It's all about adapting how we communicate and making sure their world is safe.
You know, really simple shifts in how we interact can make a world of difference. Instead of arguing about whether something happened, just validate the feeling behind it. Approach from the front so you don't startle them. Use a calm voice. These aren't just nice things to do. They can genuinely reduce anxiety and create a real connection. And that same thinking applies to their physical space too.
We're talking about really practical stuff here. Getting rid of throw rugs that are a major trip hazard, making sure there's good lighting, maybe even putting simple labels on drawers and doors. Each one of these little changes helps to make a home feel safer and less confusing.
You know, when you boil it all down, understanding this disease is about so much more than just the biology. It's about empathy, it's about community, it's about action. And really thinking about this question, about how we can build a more supportive and understanding world, that's how we move from just being aware to actually making a difference. Thank you for being with us until the end of this video. Please be sure to subscribe to the What Does Science Say channel and give us energy with your likes and comments. Share your comments with us and send the video to your loved ones so that others can also use it.